More than 1/3 of all women experience either intimate partner violence or non-partner sexual violence in their lifetime. According to data in Afghanistan, almost 90% of women experience at least one form of domestic violence, 60% experience multiple forms of violence, and 17% experience sexual violence.
Gender-based violence is a major public health problem in Afghanistan, and unfortunately is very widespread, especially in the rural areas. One of the biggest challenges is the cultural issue because of the shame attached, to such, the violences. They usually try to hide, that they are abused.
In partnership with the government of Afghanistan, specifically the Ministry of Public Health, WHO just launched a 5-year project to address gender-based violence, and specifically on a couple of areas, specifically the training. Together with the Ministry of Public Health, we will be focusing on training almost 7,000 healthcare workers, medical doctors, nurses, midwives, in the gender-based violence medical treatment protocol. But we will look beyond the training of healthcare workers. We will also look at how do we improve the health system's response with regard to gender-based violence. We have to think a little bit more broader than only the training of healthcare workers. We also have to think about how do we change the health sector response towards GBV.
GBV can cause physical, mental, as well as sexual and reproductive health problems. Gender-based violence is an urgent public health priority and a human rights violation.
بله تجربه شخصی در طول 25 سال که ما کار کردیم فوق‌العاده خشونت زیاد بوده و مشکل در اینجاست که ما اکثر پرسنل مسلکی طبی که هستن تجربه ندارن، در این مورد آگاهی ندارن و جز کوریکولوم درسیشان در بخش قابلگی نرسینگ و یا دکتر صاحبای ما پروگرام خشونت علیه زنان نبوده. پرسنل مسلکی طبی در مجموع نقش بسیار اساسی و مهم را در اینجا ایفا میکنن. اگر اینا برشان همین پروگرام گایدلاین داده شوه و اینا آمادگی بگیرن تفکیک کنن، بتانن که مریضایی که با اونا خشونت جنسیتی صورت گرفته اینا تفکیک کنن و با اونا برخورد کنن، میتونه که بسیار کمک کننده باشه.
زمانی که مریضا مراجعه میکردن به نسبت نداشتن فهم تفهیم درستی که ما داشتیم و یا ای که به اصطلاح مهارت لازمی را که ما باید می داشتیم، ما نتونستیم که مریضا را به صورت خوبترش تداوی بکنیم یا در مراجعی که لازم است رجعت بدیم. این پروتکلی که در اختیار ما قرار گرفت یک پروتکل بسیار جامع است که برای عرضه کنندگان خدمات این کمک میکنه که چطور بتونه با مریضای به اصطلاح خشونت علیهشان صورت میگیره چطور ما را تداوی بکنیم.
We recently carried out an assessment with WHO on readiness and capacity of health facilities to respond to GBV in Afghanistan. What we found was that only 10% of health facilities infrastructure was well prepared to address GBV. Around 1/4 of health facilities had private examination room and only 2% of health facilities had any kind of protocol for GBV care. All of our data really shows that we need to strengthen health sector response to GBV, and there is a lot to be done to strengthen health facilities to ensure better care for survivors.
Ministry of Public Health is working together with the health care providers to inculcate in them some sense of empathy so that they treat the gender-based violence cases and the survivors in such a way that it is centered, on the victims, and they are respected rather than threatened, and they are provided appropriate treatment and the necessary referral system.
UNFPA started an innovative multi-sectoral health response project with Ministry of Public Health in 2013. And hospitals were selected as sites for family protection centres. These centres offer basic medical services, psychological services, medical support. There needs to be a sufficient number of female health workers and female psychosocial counsellors because women prefer to see women, and it's obvious, it's cultural and religious sensitivity, but throughout the world, survivors prefer to be seen by female service providers.
با وزارت محترم تعلیم مشترکاً کار کردیم. پیام‌های بسیار مؤثر در مورد عواقب سی خشونت نظیر بر جندر شامل کوریکولوم از اونا ساختیم، هم کوریکولوم مکاتب، هم از سواد آموزیشان، و قرار است که ما چنین موضوعاتی را شامل کوریکولوم پانتون هم بسازیم. در ضمنش ما با وزارت محترم حج و اوقاف مشترکاً کار کردیم چطور ما از طریق مساجد و تکایا آگاهی مردم بالا ببریم و مردم بفهمند که متضررین خشونت مبنی بر جندر دارای حقوقی هستند، اونا اسلام را حق دادن، اونا باید در کل خدمات دریافت بکنند.
To ensure that we get zero tolerance towards gender-based violence in countries all over the world, including Afghanistan, this requires a multi-sectoral response and focusing at a zero tolerance towards gender-based violence. We are trying to do with WHO and the Ministry of Public Health to ensuring sustainability, transforming health systems, how to address it, and to make sure it is included in the curriculum from medical and paramedical training institutions.
I think it's essential that the message of peace, harmony, happy life for everyone, including men, women, boys and girls, this message should go down to each individual, to each family, to each community, each leader of the community, and from the community to the whole country. I think that's the only way the things will start changing in the society, that there should be no toleration for any types of violence and harassment against women, men, boys, girls, doesn't matter. Everyone has a right for a free and happy life.